I saw that our friend Dr. Mary Bowden had posted that she would have made, somewhere around $1.5 million if she had pushed the jabs onto her patients. That is a staggering amount of money. And no wonder when you walked in the door, they were constantly trying to sell you on it. That brings us to some other news, though, that, they did approve this Moderna vaccine, right? Vaccine, quote unquote, for kids 6 months to 12 years old recently. That was done while RFK was on vacation. That's been confirmed. Now an FDA official has been fired who, from what I have heard, tried to stop or was effective in stopping the mass approval of the mRNA jabs across the board, which is what FDA regulators wanted to do. That's Vinay Prasad. I've learned overnight that RFK did go to bat for him. But Susie Wiles and a certain investigative reporter got on the phone with Trump after RFK called and said, no, you cannot fire Prasad. And ultimately, they swayed Donald Trump to fire this official. And there's more news on the front. What do you make of the latest out of HHS? Now that, pediatricians are still, I just had a friend tell me pediatricians are still trying to push the jab on her children. And so she's just going to stop going to the practice.
Right. Good for her. Yeah. Well, I guess it's two different stories, but they dovetail very directly, don't they? It's shocking. I knew just through the last few years that pediatricians and other doctors were being incentivized to push these vaccines, which they couldn't possibly have given their patients informed consent, because informed consent didn't exist. It was experimental. And even in the experimental documents, it was killing people, sterilizing people, disabling people. And we did know that people were being incentivized to do it. But what you just shared with me, what's come out in Senator Johnson's hearing, really is stunning. I did not know that HMOs, what a corrupt system, right? The HMO itself buys the vaccines, and then the participants in the HMO, traffic the bodies of children by scaring parents to ingest the vaccines, and then the traffickers / pediatricians get $1.5 million, for doing it. And the other thing that's really creepy is this very Marxist idea that, it's not enough if you're not being paid per patient. You have to reach this kind of tipping point of a majority of your patients, or a certain number of your patients being vaccinated. And we saw that also with cities, governors, mayors were saying we have to reach 70%. We have to reach 70% of everyone in the city being vaccinated. And then there were horrible restrictions and rewards, to get to that 70%, because that released bonus money or, the flow of millions of dollars. So it's very un-American. It's definitely illegal. The Nuremberg Code doesn't apply to groups. It's an individual's right to not be experimented on. So the failures and the corruption are so multi-level in what you just shared and spelled out, and what Dr. Hooker, who's awesome, explained. I think that your friend is indicative of a real trend. Apparently just 40% of parents are fully vaccinating their kids on the childhood schedule. Parents have really woken up. So this whole disaster could turn out to have a backlash of, a particularly healthy group of kids. I've been looking at babies since 2020 because I'm so worried about babies. And for a couple of years, babies and toddlers really looked unwell. The combination of the vaccine, which, we know had horrible effects on pregnancy and childbirth, and the social restrictions of lockdowns and masks. And I was really worried about the next generation. New babies look good. I know a lot of new babies who are not vaccinated at all. And, the whole mythology around vaccines is kind of falling apart. Even the ones that we knew were safe and effective, like the polio vaccine. I interviewed someone who pointed out that whole narrative was kind of imaginary, that the causes of polio had already been done away with through better sanitation, other things, before the vaccine was even rolled out. So parents just don't trust their pediatricians anymore, and people don't trust their doctors. And so many people I know parents and just adults with their own health are doing what your friend is doing, what I'm doing, probably what you're doing, which is we just try to stay healthy on our own. And, we'll go see the doctor if our leg falls off,
Exactly.
They're really necessary.
When you lose an arm.
Exactly. The kids.
And you still almost question it, right? You're like, do I really still go?
Yeah, right. Exactly.